Hello, my name is Amber White, and I'm here to address the need for restoration and promotion of African Americans in mental health care. In the Supreme Court case of Dred Scott versus Sanford in 1857, Chief Justice Roger B. Taney stated that the black man had no rights which the white man was bound to respect, and that the Negro might justly and lawfully be reduced to slavery for his benefit. It is too clear for dispute that the enslaved African race were not intended to be included and formed no part of the people who framed and adopted this declaration. Again, Chief Justice Roger B. Taney in the case of Dred Scott versus Sanford in 1857. And jumping forward to 1932, where the Tuskegee syphilis experiment was conducted by the U.S. Public Health Service, where they withheld highly effective treatment to black men with syphilis to observe the progression of the illness untreated. African Americans were literally treated like lab rats and blatantly lied to by their white counterparts. Two obvious themes arise in this historical mistreatment of African Americans: trust and respect. Before I further explain those themes, I'd like to address some facts and statistics from our own Alameda County, where we have 180 to 190,000 African Americans. The first fact is that African Americans represent the second to smallest population in Alameda County, and they have the second to highest death rate. Generally, the reasons for that is poor health. The second thing is that at 40%, African Americans have the highest rate of chronic disease, the highest prevalence of hospitalizations and emergency department visits due to mental illness, and the highest number of avoidable emergency department visits. Lastly, African Americans fall significantly behind in those who have access to the usual sources of care. To summarize this, we simultaneously represent the population in the most need and the population being least cared for. The majority of our healthcare providers, from psychiatrists to physicians to social workers to therapists, are white. In other words, the care that African Americans are lacking is provided by whites. This brings me back to my themes of trust and respect and the evolution of the perception of African Americans in healthcare. For over a century, blacks have been treated as less than human. Naturally, skepticism and agitation are at the forefront of African Americans' minds when they compare themselves to whites, because they have gone from being literally enslaved and traded like objects to being victims of ambush disguised in police brutality, discrimination, segregation, gentrification, and one stereotype that we cannot seem to escape. We are simply ignorant and we are angry. African Americans living today have no reason to believe in the system we were born into. For many African Americans in their 20s and 30s, today it is our very own parents who are direct victims of racism and inequalities. As children, it was only in 1954 that segregation in schools was declared unconstitutional. Our parents were set up to believe that they do not belong. We're in the presence of whites. Our parents were set up to believe that they do not belong in the presence of whites. So why would they trust in their white counterparts? Why would they have any reason to trust in a society that told them that they were not equal? So even though people like me who were raised by these parents who experienced these obnoxious inequalities firsthand, our generation is expected to behave as if these things never happened because legislation has changed. In the words of William Sumner, who was a sociologist in the early 1900s, state ways cannot change folk ways. In other words, changing laws does not mean that we've changed attitudes and changed behaviors. Black people are still persecuted and oppressed, detained, and hospitalized for behaviors that are a direct response to years of trauma and distress. We've done a lot of great work on paper, but now's the time, and the Bay Area is the best place than any other to set the stage for restoring the health of African Americans in our community. Starting with better access, quality treatment, leading to higher utilization, increased adherence to treatment, and a much better quality of life. In closing, I want to clearly state and acknowledge that the present treatment of African Americans is far from the severe and indisputable racism of the past. and that the intention of bringing up this issue is not to place blame, it is not to cause rage, it is to promote the unity and inclusion and restoration of African Americans. Thank you.